It's case time.
Okay.
I feel like this is like the old war stories.
Yeah.
I had this case one time now. Okay. So I actually have two quite interesting cases. And one
Okay.
I have footage of. The guy let me take footage of and so all I'm kind of doing this from memory. So this guy's got like a high training background, right? He's been
Okay.
training for a long time, was a bodybuilder. Now he's like real big into golf.
It's
And
quite the switch.
quite the switch, quite the switch. Yep. And so I do his programming. So so I've been doing his programming for maybe like a couple years now. Uh so I kind of have that program, like I know what he's doing, and the guy's like very disciplined. So like he does it, right? Like so long story short, I first meet this guy because when he was in fourth grade, he tore his meniscus.
Hmm.
He was playing football and like went to cut, and when he cut, like somebody went to like rotate him and his foot was in the ground, and then when it rotated, boom, meniscus gave way. Okay. So then what ends up happening is, and he's from like he lives in Columbus now, but he's from like a really small town in Ohio, right? And they're like, "Oh, you're fine, don't worry about it, yada yada yada." Right? Well, then what ends up happening is they're like, "Oh, hey, this thing is like a legit meniscal tear." Like they didn't know that at first, right? They're just thinking like, "Oh, it's probably nothing." Then it's like a meniscus tear. Well, then like by the time he's in middle school, he starts having like knee surgeries.
Wow.
Okay. Has and then gets to the point where he gets a meniscus replacement,
Okay.
blows his meniscus replacement.
Okay.
Okay. So how he blows it is, and this is like later on in life, right? But his foot's planted and he goes to twist, and he says immediately he just like feels it explode in his knee,
Okay.
right? So this knee is like the knee joint is just very like arthritic already, right? Like this is a big, massive knee joint. Okay. So it's hard with like exercise selection to be like, okay, like what can we do where we don't like irritate this knee and then try to like kind of maximize the knee. Does that make sense?
Mhm.
So he's essentially like, listen, like we think we've kind of maxed out the hip. And he's like, hey, I want to get into the knee. So I'm like, okay, let's start to actually like treat this knee because before that it was more like because like everything's so golf based and it's like hip, I need rotation, spine, right? And we're in kind of just like didn't do anything with the knee. So I go to like we have an assessment on the knee. I think this should be in a video, but we get an assessment on the knee, right? And so like when this knee, so he's face down, take the knee to go up into bent knee hip flexion or knee flexion. He can only get to 90 degrees. Okay. And then there's two things that limit range of motion. One is a block on the outside of the knee where the meniscus replacement was. So he gets closing angle stuff on the outside. So I'm taking him into bent knee hip flexion, right? On the outside of the knee, you can feel the block, right? And so it blocks and it is painful. So it's a block plus pain. And then it's just super neurological. So everything's like real bouncy there.
So he was prone.
Yeah. Does that make sense?
Mhm.
So he can't feel any tissue on the opening side of the joint in like the front of the knee, the quad, anything like that. Right. So I'm like, and he's got like atrophy on that leg, obviously. Because he
Sure.
can't like all the programming that we do, it's like, okay, hey, you're gonna do a box squat and you're only gonna squat to this depth so you don't irritate that knee.
Right.
right? Hey, you're going to do rack pulls, you're not going to do a deadlift because we can't get you into that position, right? So like everything's kind of been like modified like in the lower extremity and specifically for the neural net so that like it doesn't irritate this issue,
Got it.
right? And so we're like, hey, you know what? We might as well take some time because he's been coming over like once a week. It's like we might as well take some time to see like what we can get out of this joint, right? So I'm thinking like, okay, when I go up to into this bent knee, or when I go into knee flexion, right? Like I would like for there to be some like rate limiting stuff on the front side of that joint,
Mhm.
right? And so it's interesting what I started to do. Well, I did a couple things, and I can't remember because it's been a couple weeks ago since this the first time. But it was interesting how we did it because then he was like, "Oh, like I can actually feel like my quad, I can feel my hamstring, and now I can use my quad and my hamstring to control my knee without it essentially impinging." Which is like
Okay.
huge, like I mean that's kind of like the best that we can get,
Right.
right? So essentially what I did was when he's laying down and he's in his knee is at 90, I just like compress his joint. So I just lean down through his foot so that there's like I'm trying to get into that capsule and then I start to do like passive cars,
Hmm.
right? And like it doesn't feel like really good from my perspective, but he's like, "Oh, okay, yeah, I can feel tibia moving relative to the thigh bone." So I'm like, "Okay,
Yep.
perfect." So we just do like tons of cars and then we're taking it through different angles, right? And it's like everything's pain-free within the joint, so I'm like, "Okay, this is perfect." So then I'm thinking like, okay, well, how do I just teach the neural net where his hamstring is? Right. So I'm kind of like going through a neural net perspective. And I'm going to use the internal isometric continuum to figure out what I should be doing. Right. So, so what I have him do is I have him after he does all those cars, and essentially that information is uploaded into the neural net. Right. Then I'm like,
Hmm.
okay, hold in this position. So his knee's like this. So he's holding here. And then I wrap a band around this way. And then I just start cueing him. Hey, I just want you to do a holding isometric in your hamstring.
And you're tugging on the band?
Yeah. And so then I'm just pulling on the band and then like oscillating the band so that there's like a little bit of stress stiffening so that he can feel that.
Hmm.
Right. And then what I start to do is I'm like, okay, hold. And then like we start to do eccentrics so you can start to feel where that tissue feels like lengthening.
Mm.
Right. And so now he can feel like the entire hamstring. So now I
Hmm.
take it back.